Let's discuss the Chinese medical theory, Chinese versus Western medicine, part 2. The integration of Chinese and Western medicine began in earnest following Mao's lead. By the 1960s, colleagues of Chinese medicine had been established and teams of scholars wrote textbooks in modern Chinese language, systematically laying out the principles of Chinese medicine for the training of a new generation of Chinese doctors. These textbooks followed the style of Western medical books, each volume covering a specific area such as basic medical theory, pharmacology, diagnostic techniques, internal medicine, pediatrics, gynecology, skin disorders, and acupuncture. This method of studying medicine through standard text was in contrast to the old way of learning from ancient medical classics, studying recorded cases of famous or legendary physicians and sitting as apprentices at the feet of experienced practitioners. As medical colleagues grew and expanded, postgraduate degrees and extensive research programs were introduced. Okay, today dozens of Chinese medical universities and colleges turned out large numbers of doctoral dissertations and publications by Chinese as well as international research students from Japan, Korea, Singapore, Australia, Europe, and the US. The modernization of Chinese medicine resulted in a systematization of Chinese medical theory not to be found in the classics, as well as additions to the theory that implicitly incorporated Western notions like viruses and bacteria, which is termed toxins, and borrowed concepts like the immune system and essential vitamins and minerals. The result of these sweeping changes was the birth of the traditional Chinese medicine, the modern form of Chinese medicine. TCM was traditionally only in the sense that it kept intact the main core of ancient Chinese medical theory. In the rest of this book, we use the term TCM theory to refer to the modern systematized form of Chinese medical theory. TCM attracted attention in the West following President Richard Nixon's historic visit to China in 1972. Western doctors saw Chinese medicine at work and witnessed the use of acupuncture to treat pain as a form of anesthesia. This arose interest in TCM as a system of alternative or complementary medicine. In recent years, rising rates of serious illness like heart disease, stroke, cancer, and diabetes, even as Western medicine made spectacular advances in knowledge and technology, may also have influenced patients to seek alternative methods of healthcare. 60 years after Mao's edict for Chinese and Western medicine to work together, the ideological differences between them have largely remained unresolved. Integration of TCM Western medicine has taken place only to the limited extent that TCM physicians are sufficiently trained in Western medicine to use both system of medicine in their clinical work, while Western trained doctors take short courses to expose them to the basics of TCM. For the TCM physician, diagnosis by TCM methods is supplemented by laboratory tests and modern diagnostic procedures like blood tests, X-ray, MRI, PET scans. The treatment administered could be a combination of Chinese herbs, acupuncture, and selected Western pharmaceuticals such as antibiotics, steroids, and anti-inflammatory drugs. These physicians think in TCM terms when they diagnose the imbalances underlying an illness and decide the therapies to be administered accordingly. They would be prepared to and often do supplement TCM treatment with Western drugs to address more urgent conditions, including antibiotics for bacterial infections and steroids for acute inflammations. The term imbalance is used here in the generic sense of abnormality or deviation from the healthy state of the body. The kind of imbalance in particular pathological conditions is more precisely defined by TCM as deficiencies in yin and yang, and or the presence of pathological conditions like heat, cold, dampness, phlegm, and blood stasis. These terms are used in TCM in a different way from ordinary medical language and will be explained in subsequent chapters. Thank you for your attention.